Hello, my name is Brandon Blanford. I will be discussing a patient that's a 55-year-old female who currently lives with her daughter and boyfriend. She receives disability due to her inability to function properly due to some syncopal episodes. She came into the ED due to some fluid overload, some edema in her legs. She has some shortness of breath. She has an allergy to amoxicillin and erythromycin, and she's a full code. Vital signs on admission were 99/82 with a MAP of 85 as her blood pressure, a temperature of 98.7, respiratory rate of 24, heart rate of 122, and the patient's breathing heavily. She has a poor skin turgor. She's the EMV of 15. There's some crackles in her lungs. She has some PVCs on the monitor. She says an increased heart rate, and her LVAD, her left ventricular assist device, is audible when listening to her lungs. Her abdomen is very obese in appearance. She has some generalized edema in her abdomen. She has 2+ edema in her legs, and her feet are cool to touch. She is currently on aspirin, 81 milligrams, 4 milligram of warfarin, Protonix, 40 milligrams, and metoprolol, 12.5, 2 times a day. She has a past medical history of postpartum cardiomyopathy, an ejection fraction of 20%. A biventricular ICD has been placed. She has an LVAD, which is a heartmate 3. She has chronic kidney disease, hypertension, hyperlipidemia, asthma, obesity. She's an ex-smoker, and she has osteoarthritis. Her past surgeries was the LVAD being placed, endometrial ablation, hysterectomy, cholecystectomy. To a little bit of a history on her parents was her dad had type 2 diabetes, hypertension, and skin cancer, and her mom is deceased due to a myocardial infarction. She had type 2 diabetes and gout also. Some of the risk factors for congestive heart failure are increased age, obesity, valvular problems, smoking, and alcohol. According to the American Heart Association, congestive heart failure is when the blood flow out of the heart slows, the blood returning to the heart through the veins back up, causing congestion of the body's tissues. Often edema results. Most often there's swelling in the legs and the ankles, but it can happen in other parts of the body as well. Sometimes the fluid collection in the lungs, which interferes with the breathing, causing shortness of breath, especially in patients lying down, such as with this patient. It can also mess with the kidneys due to the sodium in the water not filtering properly and the body retaining onto the water. There's different types. There's left-sided and right-sided. With left-sided, there's reduced ejection fraction, which is called systolic. The left ventricle loses its ability to contract normally, and the heart can't pump with enough force to push the blood into circulation. And then there's diastolic, which is there's preserved ejection fraction. The left ventricle loses its ability to relax normally. The heart can't feel properly to pump it out. So with right-sided heart failure, it's a result usually from left-sided heart failure. When the left ventricle fails, increased fluid pressure is transferred back through the lungs, ultimately damaging the heart's right side. When the right side loses its pumping power, the blood backs up into the body's veins with some congestion of the legs, ankles, swelling within the abdomen, such as the GI tract or liver, which causes ascites. Some of the symptoms that people see with congestive heart failure, and some of these are what that my patient had, was shortness of breath, fatigue, weakness, swelling, rapid or irregular heart rate, reduced ability to exercise, persistent cough or wheezing, increased urinate at night, swelling of your abdomen, very rapid weight gain due to the fluid retention, difficulty concentrating, or decreased alertness, sudden severe shortness of breath, chest pain if heart failure is associated to a heart attack. Some of the treatment that is used would be diuretics, beta blockers, ACE inhibitors, vasodilators. Exercise, weight loss, low sodium diet are modifiable risk factors for these patients. So for some of the diagnostic tests that these patients would have, they would have like a EKG done just to assess their rhythm, the underlying rhythm. An echocardiogram to just get a ultrasound of the heart to see if there's hypertrophy or swelling, or if the heart's not pumping or filling correctly. A stress test, that can be nuclear or they can be exercise induced. Chest x-ray just to see if there's swelling of the heart, and a cardiac cath to see if there's blockages, if there's stents that need to be done for diagnostic purposes. If this patient in particular had all these, and what they did before they did the LVAD, which is the left ventricular assist device, which is basically a fake heart. It goes into your heart and it pumps the blood around. It's kind of like a motor. So a patient, whenever they go for that, they can get on milrinone, which is a vasodilator, which lowers the blood pressure, so it helps the heart to pump easily. And they can do that, or they can be put on an LVAD. They can be the LVAD and the milrinone are basically just prolonging their life, whereas sometimes there's a bridge to transplant. This patient was not a candidate for a bridge to transplant, but she did get an LVAD. So that's basically the stuff that she can do. For the referrals and discharge plan, the patient went home. She's back in very, very normal. She's usually gone for a couple days and then comes back, just because she's not compliant with her diet. She eats whatever she wants. She drinks whatever she wants, however much she wants. The patient is seen a week after discharge, and then she's usually seen every month after that, one time a month, unless something needs to be fixed, or the patient isn't in the hospital, because that's usually where she's at. She has access to the VAD coordinator's phone number, so if she has any questions throughout the night or whenever, she can contact them. She is able to call at any time. If there's an emergency, they tell her to go to the hospital. She can't go to just any hospital due to the VAD. She has to go to a hospital that has stuff like that. So the University of Kentucky is a place that has the resources for that. Thank you.